Hello, everyone, and welcome to our fifth in the review session series. We will get started in just a minute or two. If you've been on the previous sessions, you know we just like to have folks put where they're calling in from in the chat so we can see what kind of representation we have from across the country. So great, we have San Francisco, yay, Maryland. I love it. We've got one coast to the other coast, and now we've got in the middle, Illinois and Madison. Cool. This is lovely. Great to see you all again. We're excited to get started. This is our next to the last session, believe it or not. We'll have our last session. Oh, I'm glad we had the Choctaw Nation. We'll have our last session the Tuesday after 4th of July. If you're hearing an echo, maybe can I just hear, maybe you all could put in the chat if you're hearing an echo so I can just see if it's just one person or multiple people. Okay, great. If you are hearing an echo, sometimes it's good to just log out and log back in. Make sure that you have your, I don't even know if you all can unmute. If you're on your computer and your phone, you may have to hang up one of them. So thank you all for letting me know that the most of you do not hear an echo. So that's wonderful. Great. And hopefully today we'll have our polls working fine. You guys, you all are very familiar with us and our poll struggles, but I think we may finally have it conquered. I'm sorry you're hearing an echo, but if you want to try to log off and log back on, maybe that will help. Yep. Okay. All right. Once again, welcome everyone. It's 2:01, which is the time when I usually get started. Oh, wow. I already have people with their hands raised. Can you put your question in the chat and then we'll try to answer it there, just so we can go ahead and get started. And if we can't answer it, if we do have time in the end, or if we have a little pause, we can try to answer some questions. Again, welcome to the fifth session in the CDI review session series. My name is Melinda Salmon, and I work with NBPHE to support the implementation of the CDI. This is our fifth of 6 review sessions. They've happened every Tuesday, and next week will be our final review session. These sessions provide an opportunity to review key domain concepts, discuss the application of knowledge, and strengthen your understanding of the content areas represented on the exam. Today's session, as I mentioned, will be Domain 5, and that is collaboration. Before we begin, I like to cover just a few housekeeping items. This session is being recorded, and as Melissa mentioned, I think Melissa put in the chat, if you don't know Melissa, she's been the driving force behind this effort. So thanks, Melissa. She did put a link in the chat to where the recordings are. So if you happen to miss any of the previous sessions, feel free to go back and look at and watch those. Melissa and I will be monitoring the chat throughout today's session. So please feel free to submit questions related to today's content in the chat. We will do our best to answer your questions while the session is occurring. If you have questions specific to your CDI application, the exam process, scheduling, please email us at info@nbphe.org, and we will follow up with you to assist you and get some answers. Thank you for investing your time, and we hope you find the series valuable and informative. So with that, thank you. Brandon's helping me with my slides today. So if you haven't already read our funding statement, I will just go through it really quickly. Once again, this project is supported by the Centers for Disease Control and Prevention under a cooperative agreement. You can see the number there, awarded to the Association of Schools and Programs of Public Health. and subawarded to us, the National Board of Public Health Examiners, under this funding opportunity. The contents of the presentation are those of the authors and do not necessarily represent the official views of nor an endorsement by CDC, HHS, or the U.S. government. Slide. If you haven't yet visited our university website, you can scan the QR code right there, and it'll take you to this great resource to help you study and get informed. There are there are links to the study guide, there's an interactive study tool, there are flashcards. So this is really your place to go to learn everything that you need for certification. Next slide. As I mentioned, today our presentation is on collaboration. Next slide. And we are so lucky and fortunate to have Brandon Heinbaugh here with us. He is a senior manager in program operations and training, working for the National Coalition of STD Directors. Brandon lives in Indianapolis, Indiana, and he's a public health professional with experience supporting DI programs through workforce development, training, technical assistance, and national capacity building efforts for STI and HIV prevention and response. So we're thrilled to have Brandon here with us. And Brandon, please take it away.
Appreciate that. Thank you for the warm introduction. Uh, like they said, my name is Brandon Heinbaugh with the National Coalition of STD Directors. Hopefully, you all have seen my face at some point over the last several years in a training or just another various projects that we hopefully get to push out to you all. I'm really happy to be here today to talk to you about collaboration and what that means and looks like in the field of disease intervention. So we have a lot of great content to get through today. And then we'll have some practice questions at the end, like I know you all have been used to, some knowledge checks in between. But overall, I think it'll be a great time together. So in today's session, we will provide an overview of Domain 5, which again focuses on collaboration. We'll have about 5 sections to go through together, some knowledge checks in between, like I had noted, and those practice questions at the end to kind of help align everything better with the CDI exam. All right, let's get started. So collaboration in total is going to be about 15% of the exam. Just a quick note about examples. Examples in this presentation are for the purposes of CDI exam preparation only and may not reflect local procedures. So please remember to follow your jurisdiction and agency established protocols when engaging in collaboration related activities. All right, so there are going to be 5 main tasks for this domain. Number 1 is looking at how we collaborate with healthcare and other service providers. Second, we're going to look at how we can help educate healthcare providers on jurisdiction requirements or reporting compliance. 3, how we serve as a local resource to relay public health information and CDC recommendations to the community and providers. And 4th, participate in collaborative case review to identify and discuss opportunities for enhancing case management strategies and intervention. And then finally, how we adhere to public health principles during collaboration. The roles and responsibilities of disease intervention professionals are fundamentally collaborative in nature. As you can kind of see on your screen, we work a lot with community engagement and partnership, health equity and social justice, some leadership things, program planning and evaluation, right? Disease intervention professionals, who conduct disease intervention activities, including but not limited to person-centered interviews, collection of enhanced service or surveillance and community assessment data, contract chasing, contact tracing, thank you, field specimen collection, field investigation and outbreaks, emergency preparedness, community outreach, in collaboration with medical providers, all things that we'll touch on a little bit today. All right. So collaboration in public health must be grounded in strong ethical principles. The Public Health Leadership Society outlines a widely recognized framework in its report, Principles of the Ethical Practice of Public Health, which identifies 12 ethical principles that guide public health professionals in their work. These principles help ensure that public health actions protect communities while also respecting the rights and dignity of individuals. When applied in practice, they support equitable access to respectful, high quality care for people who have been diagnosed with or exposed to infectious diseases, as well as for the communities affected. So, for disease intervention professionals, these ethical principles are especially important in collaboration with community partners. They guide how we communicate, how we engage respectfully with individuals and communities, and how we really ensure that public health actions are responsive to the needs of the populations that we serve. So here on your screen, these principles kind of highlight the ethical considerations that guide public health practice and collaboration. So first, building partnerships helps us strengthen trust and improve the effectiveness of public health efforts. At the same time, professional competence and the timeliness of services ensure that communities receive accurate information and support when it is needed the most for them. Ethical public health practice also includes community input and interventions and policies, along with obtaining informed consent when working with individuals diagnosed with or exposed to infectious diseases. And then finally, public health professionals must maintain awareness of difficult perspectives, use people-centered approaches, and and ensure that the needs of disenfranchised or underserved populations are addressed while protecting individual rights and confidentiality. And then, sorry. And then altogether, these principles really help guide ethical, respectful collaboration with both health and non-health partners. When working with communities and partners, disease intervention professionals should always be mindful of their professional and ethical conduct. So, professional behavior plays a really important role in building trust with people who are diagnosed with or exposed to a communicable disease, as well as with healthcare providers and external partners. Expectations for professional conduct are often defined by an individual's employer and may include, providing person-centered, non-judgmental services, maintaining confidentiality, and demonstrating ethical behavior in all interactions. But in addition, DI professionals must ensure that all program activities comply with the federal, state, tribal, local, and territorial laws as well, and statutes as well. Following these standards helps to ensure that, public health work is conducted responsibly, ethically, in a way that protects both individuals and communities. Professional conduct in disease intervention work includes several key behaviors that help really build that trust and maintain ethical practice. One important expectation is using professional communication techniques, which means, speaking clearly and respectfully and in a way that is appropriate for the situation and the audience. DI professionals should also consistently show respect for the people receiving services, recognizing their dignity, experiences, and individual circumstances. And then maintaining a professional boundary and following workplace policies, another critical part of ethical practice. This is going to help ensure that, all interactions remain appropriate and focused on providing effective public health services. In addition, DI professionals must maintain confidentiality and protect sensitive health information. And finally, operating with honesty and integrity helps reinforce that trust with individuals, communities, and our partner organizations. And together, all of these behaviors reflect the professional expectations that support effective and ethical public health collaboration. Okay. We have our first knowledge check. I believe we're going to try out our polls with this one as well. Is that correct?
Yes. So here,
Awesome.
I've got to relaunch the poll. So continue. Right.
Awesome.
So everyone, we got our poll to work. Yay! So if you all could just take a minute and answer this knowledge check. And I
How
always
can we
try to get to a certain number. Maybe we've got 134 people here. If we can get to 100, that would be wonderful. Um, so we can
get a great
show.
crowd with us today?
Yeah, yeah, I really appreciate everyone's participation. We're at 97, 98, 99, 100. Thank you all so much. All right, I'm going to end the poll and share the results.
99% voting the correct answer, which was
Okay.
B, providing patient-centered care and avoiding inappropriate behaviors and interactions. Absolutely.
Great job, everyone.
Yeah. So kind of giving some additional rationale behind this, DI professionals work hard every single day to provide non-judgmental and inclusive services. And this can look more unique based on where you are. So each jurisdiction has unique services that are going to vary based on the needs of their local communities, right? And so when we're talking about this maintainment of professional and ethical conduct, I wanted to throw in kind of and maybe a real life example, something maybe some of you have already experienced in some way, shape, or form, or if you're brand new to the DI workforce, this is something that, could be a good learning moment. So I wanted to be sure to provide it. But in practice, this could look like, if a DI professional had been working with a patient over the course of several weeks to help notify their partners and help them navigate treatment, during that final meeting, what if that individual patient said, you've helped me more than anyone else has. Can I get your personal phone number in case I ever need to talk about anything like this again? Or maybe could we connect on Facebook? And immediately, like as a DI professional trying to maintain these professional and ethical conduct and standards, we could say something like, I really appreciate you saying that, and I'm glad you could help. But to protect both your privacy and mine, I can't communicate through my personal phone or social media. But if you need anything else in the future, you can always reach me through the health department or our main office line, and we'll be able to make sure you get the support you need. So the DI professional in these moments are going to continue to provide that compassionate, patient-centered care while and people-centered care while really maintaining that appropriate professional boundary. All right. So health literacy is an important public health principle that supports effective communication and informed decision making. The CDC describes health literacy as having two main components: personal health literacy and organizational health literacy. Personal health literacy refers to an individual's ability to find, understand, and use health information and services to make decisions about their own health. This can carry or can vary widely depending on a person's access to resources and education and support systems, while organizational health literacy focuses more on the role of organizations, right? It refers to how well organizations design and share information in ways that can then help people understand and use services to make better informed decisions. So, for disease intervention professionals and their partners, improving health literacy may involve using plain language, communicating in a person's preferred language, and ensuring that materials are culturally and linguistically appropriate. These practices help individuals really better understand health information, which can improve their own confidence in making health decisions and ultimately lead to better health outcomes. So, health is influenced by many social and economic factors, including access to education, resources, language, and healthcare services. Because of these factors, individuals may experience different levels of health literacy. And this makes it especially important for public health professionals to communicate information in ways that are clear and accessible. So when we're collaborating with partners, DI professionals can support health literacy by using plain language so that way, information is easier to understand. We could also communicate in an individual's preferred language and through communication channels that work best for them, whether that's written materials or phone calls or digital communication. And finally, it's important for us to use culturally and linguistically appropriate language so that information respects and reflects the experiences and the backgrounds of the populations that we're serving. Integrating these practices into collaboration really helps to ensure that individuals can better understand health information and make better or more informed decisions about their care. Disease intervention professionals often work with individuals from a wide range of backgrounds and experiences and perspectives. And because of this, it's really important to maintain an awareness of different perspectives and approaches, perspectives and approach working in these situations using a people-centered mindset. While training and experience provide a really strong foundation, it's not really possible for professionals to fully understand every aspect of a person's cultural background or lived experience, right? Instead, DI professionals should practice ongoing humility and self-reflection, recognizing that learning about communities and individuals is a continuous process. This approach really encourages respectful communication and flexibility and attentiveness to each person's unique needs, which, helping build a stronger relationship and greater trust within the communities that we're serving. Respectful engagement can be demonstrated through several practical actions in everyday public health work. For example, providing resources and written materials in multiple languages helps ensure that information is accessible to the people receiving the services. Having a translator or interpretation services available can also improve communication and help individuals better understand important health information. Respectful engagement may also involve, adapting treatment or care plans to accommodate cultural or religious beliefs whenever possible. And then finally, practicing active listening and asking thoughtful questions allows DI professionals to really better understand a person's needs, preferences, and comfort levels. These actions really do help create a more supportive and responsive experience for individuals that are receiving services. Using a person-centered approach really allows for disease intervention professionals to tailor their work to the more unique needs and experiences and circumstances of the individuals and communities that they serve. This means recognizing that each person may have different cultural backgrounds and values and preferences that should be considered when providing services. By adapting communication and engagement strategies to better fit these needs, DI professionals can create a more respectful and effective interaction. In taking this individualized and culturally responsive approach helps to strengthen relationships and build trust with community partners and ultimately supports public health efforts that better meet the needs of the populations being served. So let's talk about some basic epidemiology. Epidemiology is a foundational science in public health and plays a key role in the work of disease intervention professionals. The CDC defines epidemiology as the study of disease and other health outcomes, including how they occur, what causes them, and how this information can be applied to then control health problems within populations. For DI professionals, epidemiology provides the framework for understanding how infectious diseases really spread and how public health responses should then be designed. When working collaboratively with partners, DI professionals may also be responsible for explaining basic epidemiological concepts and ensuring that prevention and response activities follow sound public health practices. So in practice, Applying epidemiology in collaborative work can really take several forms. DI professionals may help partners understand patterns of infection within different communities, or, including this could also include like which populations may be the most affected. They may also communicate factors that increase or decrease the risk of an infection, which helps partners better understand how behaviors and environments and social conditions influence disease transmission. And then finally, DI professionals work with partners to implement interventions that help to reduce the spread of infection. These interventions may occur at the individual level, such as counseling or referrals, or at the community level, such as outreach and education and prevention programs. And then using epidemiological principles helps to ensure that the public health actions are informed, targeted, and effective. So health outcomes are influenced not only by biology, but also by economic and social factors, right? So DI professionals may observe that differences in education, income, or living conditions can affect how individuals access healthcare or maintain consistent health practices. These non-biological influences can include factors such as a person's physical environment, access to nutritious food, housing stability, economic resources, right? And understanding these conditions helps DI professionals um, better recognize the barriers some individuals may face in when they're seeking that healthcare service or, trying to follow a prevention guidance. And then being able to recognize these factors also allows DI professionals to plan services that are more practical and more supportive and more responsive to the realities of the communities that they serve. Overall, economic and social factors highlight why cross-sector collaboration is essential in public health. Health outcomes are shaped by many conditions outside of the traditional healthcare systems, making partnerships with community organizations especially important. When DI professionals apply a people-centered approach in these partnerships, they can more effectively identify and respond to the needs of individuals diagnosed with or exposed to an infection. Working collaboratively with community partners helps create a more comprehensive public health response and supports improved outcomes for both individuals and communities. All right, let's talk about confidentiality. So, protecting individual rights and confidentiality is a core ethical responsibility in public health practice. Confidentiality refers to the duty to like safeguard protected health information or PHI and ensure that sensitive health information is kept secure and private. And so, under the Health Insurance Portability and Accountability Act, or HIPAA, the privacy rule states that protected health information cannot generally be used or shared without the written consent of the individual. And this rule really helps to protect the privacy of people receiving healthcare services and then builds trust between individuals and public health professionals. So for DI professionals, maintaining confidentiality is especially important because of how often their work involves sensitive health information, right? Whether information is being shared electronically or on paper or verbally, maybe, it must always be handled carefully to protect the privacy of the individuals and communities, particularly when we're collaborating with multiple partners and organizations. While HIPAA protects the privacy of health information, there are some specific exceptions that allow protected health information to be shared for public health purposes. So, for example, certain diseases require mandatory public health reporting, which then allows public health agencies to kind of track and respond to these infectious diseases. So DI professionals may also share relevant health information with healthcare providers directly involved in a person's care when it's necessary for treatment or for public health response. Even in these situations, TI professionals should really follow the established local protocols, typically sharing only the minimum amount of information necessary to achieve that public health goal. And it's important for DI professionals to be familiar with any additional state, tribal, local, or territorial laws and regulations that then govern privacy and confidentiality, as requirements can kind of vary across jurisdictions. All right. So we have a little scenario for our next knowledge check. DI professional is assigned a chlamydia case for a 16-year-old. When they call the number listed on the case report, the parent or guardian answers and demands to know why the DI professional is calling. How should the DI professional proceed? And we have a poll for you again. So take a moment, think through that one, and tell me what you all believe would be the best way to go about proceeding with this scenario.
Yeah. So the poll's been launched. I think many of us who have been DI professionals, especially in the STI world, have come across this scenario. So give it your best answer, and I will share the results in about 30 seconds. Again, I like to get to 100. That makes the percentages easy to calculate.
Yes.
Not that I have to do it, but
And
all
while
right.
people are thinking about this, I guess it's always good for us to acknowledge that some disease processes impact children, and you would actually speak to a parent for like a measles case or a positive lead result or, pertussis in a 3-year-old. You're obviously not going to um, interview the 3-year-old without the parent's assistance. So I guess for the purposes of this, let's assume it's something like in an adolescent around STI or HIV, or maybe an adult child living with mom. Um, if that helps you think through it better. But we do know that there are times where in certain infectious disease processes that you would talk to a parent. So there are different regulations depending on the nature of the disease.
Thanks, Melissa. And you guys did wonderful. We're already at 105 responses, so I'm going to end the poll now and share the results.
Awesome. 90% of us chose the correct answer, which is A, explain that confidentiality and ask the parent or guardian to have the person who is diagnosed with an infectious disease to contact the DI professional at a time later. Great job, everybody. So I think again, wanting to kind of go into a bit more rationale with this, it is like understandable that a parent or guardian would be concerned about their child and want to ask for more information. The DI professional can stress the urgency of making contact with the person diagnosed with an infection while still maintaining confidentiality, right? So many jurisdictions have specific laws or regulations regarding the protection of confidential reproductive health information, and that includes minors as well. So DI professionals should be familiar with their laws and their jurisdiction. Definitely want to, work with your team and supervisors and the support that you need on this one if it's ever confusing. But be sure to understand and follow those specific laws within your jurisdiction. All right. Here are some of the key words in this section. Again, if you would like to kind of study these a little bit more, get more familiar with them, you can refer to the CDI study guide for the more full definitions. Okay, let's jump into our next section. All right, so we're going to talk about provider education and training. And in collaborative public health settings, disease intervention professionals often serve as a really important source of information and guidance for healthcare providers and community partners. One of their key responsibilities is helping partners understand public health practices and requirements that support effective disease prevention and response. This may include, providing training on jurisdictional requirements, kind of like we were just talking about. That could be like a local or state procedure. Um, or things related to specifics on disease investigation or reporting. DI professionals may also help partners understand reporting compliance measures, ensuring that required public health data is submitted accurately and on time. And then in addition, DI professionals frequently share current public health recommendations and information, helping partners stay informed about best practices for prevention and testing and treatment and follow up and all of these things that we do, right? And so by providing this education and support, DI professionals help strengthen that collaboration, and ultimately improves the ability of partners to serve their communities effectively. If healthcare providers, including clinicians and laboratorians, often rely on expertise of disease intervention professionals to better understand public health requirements within their jurisdiction. Again, DI professionals can serve as a resource to help providers navigate these expectations and ensure that the public health practices are being followed correctly. This may include educating providers on reporting notifiable diseases, which are essential for tracking and responding to infectious disease cases. DI professionals may also assist with case report documentation, helping ensure that all the information is submitted to public health agencies is accurate and complete. And then in addition, DI professionals may guide providers on how to communicate with individuals who are diagnosed with or exposed to an infection, as well as share information about current disease trends within the jurisdiction. And they may also provide treatment recommendations and prevention guidance related to notifiable diseases, helping healthcare providers respond effectively and support broader public health efforts. Notifiable diseases are conditions that, when diagnosed, must be reported to state or local health authorities. The CDC defines these diseases as ones that require reporting because of their contagiousness, severity, or frequency. And reporting these diseases allows public health agencies to monitor disease trends, investigate cases, implement prevention and control measures. And then timely reporting is also very critical with this, for identifying outbreaks and protecting the health of the community. Disease intervention professionals often help ensure that healthcare providers understand which diseases are reportable and why reporting is important for the public health response overall. There are some specific requirements for reporting notifiable diseases, and those are determined by each state or jurisdiction. These requirements may include how quickly a case must be reported, which agency should receive the report, which diseases or conditions are required to be reported. And because of these requirements varying by location, DI professionals must be familiar with their own jurisdiction's reporting laws and procedures. They also play a really important role in communicating these expectations to healthcare providers and other community partners, really helping to ensure that reporting is accurate and timely, and again, compliant with local regulations. Reporting processes can differ from state to state even. So for like example, in Delaware, providers may submit reports for diseases such as chlamydia or gonorrhea, and the report must include certain patient details like name, race, date of birth, and sex. But in Georgia, notifiable disease reports are submitted through an electronic reporting platform, known as the State Electronic Notifiable Disease Surveillance System, or SINS, if that's how you Georgians say it. I'm not quite sure if I said that right. But these examples kind of highlight how reporting systems and requirements vary by jurisdiction, which is why it's important, again, for DI professionals to really understand the specific policies, where they work, and then to help partners navigate those systems effectively as well. Case reports are a really important part of public health surveillance and disease investigation. This information that's used in the case reporting can come from several sources. So these sources may include laboratory reports, healthcare provider reports, medical records, such as like electronic health record, public health clinic databases, and previous DEI or interview records. And collecting information from multiple sources helps public health professionals build a more complete understanding of a case and supports accurate disease tracking and response. Case reports typically include several types of information that help public health professionals understand and respond to a disease case. This may include details about the diagnosis, symptoms, and treatment the person is receiving. Case reports also contain some demographic and contact information, which then helps public health teams, follow up appropriately. In some cases, sexual or social history may be also included to better understand potential exposure risk and support other prevention efforts. And all of this information is collected as a part of a confidential surveillance activities, that help public health departments monitor and control disease spread. Health alerts are different from case reports, but this is a term that you should become familiar with. While case report documentation information is about individual cases, health alerts are notifications sent by health departments to healthcare providers and public health partners. These alerts are used to inform partners about increases in disease cases or emerging public health concerns within a specific jurisdiction. By sharing this information, health departments really help providers stay aware of current disease trends and respond quickly when needed. The CDC website also provides several resources to support case reporting and communication with partners if that's ever needed. And these resources can include, comprehensive interview record templates, health alert templates, which public health departments and DI professionals can then use to kind of standardize their documentation and communication practices. And then, using these tools can also help to ensure that the information is consistent and clear and aligned with national public health guidance. So, when communicating across organizations, agencies, and community networks, it's really important to be able to identify and use the audience's preferred communication channel, right? We want to choose the right method that's really going to help ensure that the information is received clearly and efficiently. In healthcare settings, electronic health records or EHRs are commonly used to communicate between providers. These systems really help providers kind of share patient information and documentation and are able to be updated securely. However, non-health sector partners such as community organizations may rely on other communication methods such as email or phone calls, reports, or meetings. And understanding these differences can really help DI professionals share information effectively across a variety of partners. All right. So into communication skills, effective communication with patients, healthcare providers, and community partners also requires strong interpersonal communication skills. Two important techniques include active listening and conflict management or resolution. Active listening involves fully focusing on the person speaking, showing engagement, and ensuring that their concerns or questions are understood. And this approach helps build trust and stronger relationships with individuals that are receiving services. Conflict management skills are also really important when working across organizations and communities, helping DI professionals really better address misunderstandings or challenges in a like respectful and more productive way. DI professionals can also support healthcare providers by sharing effective communication strategies for interacting with patients in their communities. One important practice is using person first and destigmatizing language, such as saying people living with HIV instead of labeling individuals by their condition. And this really does help to maintain that respect and reduce stigma. Using plain language and speaking clearly at an appropriate pace can also make health information easier to understand. And finally, it's really important to recognize that communication preferences may vary based on factors such as income or race or ethnicity or education. And being aware of these differences helps to ensure that communication is inclusive and accessible for diverse populations. Healthcare providers may sometimes also need information about current disease trends that are going on within their own jurisdiction, such as increases in cases or emerging outbreaks. And in these situations, they can consult with their local or state epidemiologist who's more specialized in analyzing disease surveillance data. Disease intervention professionals can also help support this process by facilitating communication between the providers and epidemiologists. By connecting these partners, DI professionals really help ensure that providers have access to accurate and up-to-date public health information. DI professionals may also share health department data reports or surveillance summaries with providers and community partners. This is going to help provide this information to partners to help them stay informed about disease patterns and support more effective prevention and response efforts. All right, here's another scenario for everyone to think about. A DI professional has identified a small cluster of cases in a densely populated area. What do you all think is a good way to ensure that medical providers in the area are aware of cases and prepared if they begin seeing people present with symptoms?
Okay, I am launching this. This is a short answer poll. So Brandon, I don't think I can share the answers, but once I have a number of responses, I can sort of go through them with you
Yeah.
and for the audience. So I've got 7 responses, so I will wait for a few more. If you all could just put your ideas, anything you think of, uh, in the answer box so we can just get an idea of what you are thinking. And someone has their hand raised or did have their hand raised. Okay, it's not raised anymore. Or not that I can see. Okay, so I am going to end the poll and I will go through, talk about clusters. Oh, okay. And I will go through some of the responses so we can just see. Or let me see, can I share the results? Did anything show, Brandon?
It's just showing that the question was answered, but it's not showing individual responses.
Okay, gotcha. Okay, so I will go through them. And some people put some stuff in the chat. Okay, thank you for letting me know. I am gonna close that. Okay. Inform them about hotspots nearby, provide data, ask if they have seen an increase in the communicable disease. health department can send email notification to the provider. Someone indicated send out a HAN type alert. Another person mentioned a HAN. Someone says an internal press release for a group, provide statistics, group email with pertinent info to providers, have a call with some of the facilities. A lot of people said send out a health alert or a HAN, so that's great. Yeah, so a lot of people are definitely on the right track, and I see some other people are putting their responses in the chat, which is totally fine. We appreciate you all sharing.
Yeah, thank
And
you.
Melissa, I don't know, did you want to
Oh, I was
mention
just going to
anything?
add, for all those years that I was in Alaska, we had really close relationships with our kind of key clinical providers, like some of our FQHCs, the folks that were doing Ryan White services, even some of our urgent cares that tended to diagnose. And sometimes we would go in and do like a lunch and learn or almost even grand rounds, like in the facility, go in and really do an overview of everything that we were seeing, the recommended, testing technologies for whatever it was, pretty early in an outbreak. So in addition to formal things like dear colleague letters and health alerts, we would go in and do like a presentation and show face and really build that relationship. And it really helped us get almost immediate provider kind of buy-in on increasing screening or whatever it was that we were asking them to do.
Great, thanks for sharing. I'll turn it back to you, Brandon.
Cool. Yeah, so you all touched on so many of these, and also thank you, Melissa and Melinda. And I think an important role for DI professionals is to educate healthcare providers about trends, right? And infectious diseases and different things that we're seeing. It's important that we have and continue to maintain those relationships so that way we can effectively communicate all of this with them. And that way they can be ready for the way that they're, treating their and serving their patients as well. Again, we could do this through educational resource packets, offer to do presentations, share updated testing and treatment guidelines, testing technologies when they become available. And then maybe offer like getting the team further involved and asking a supervisor about maybe publishing a provider notification of some sort. All great ways to kind of help again continue to maintain this communication and build that trust and relationship among providers. Okay, that keyword there we're gonna look for is the health alerts. And again, if you want a more full definition, you can refer to your CDI study guide for that. All right, let's start our third section, serving as a local resource for providers in the community. So state, tribal, local, and territorial health departments play a really important role as a local source of public health information. These agencies really help to ensure that communities and healthcare providers have access to accurate, up-to-date guidance that's related to disease prevention and control. Because of this responsibility, health departments often serve as the link between national guidance and local implementation. They communicate recommendations and guidance from organizations such as the Center for Disease Control Prevention or CDC, and help really translate that information into practical actions for providers and then community partners. For disease intervention professionals, this means frequently serving as a local resource for information, helping partners to better understand current guidance, connecting them with relevant resources, and supporting effective public health response within their communities. Educational resource packets can be valuable tools for sharing public health recommendations and guidance with healthcare providers and community partners. These packets often include materials such as fact sheets, informational posters, maybe some guidance documents that really, again, better help partners understand the prevention, the testing, the treatment, and the reporting expectations, including trusted evidence-based resources from places like the CDC can really help to ensure that that information is being shared that is accurate and aligned with national public health guidance. So, for example, packets again could include resources like the CDC sexually transmitted disease treatment guidelines, which provide clinicians with recommendations for prevention, diagnosis, and treatment. Other useful resources may include materials such as the CDC Manual for the Surveillance of Vaccine Preventable Diseases and the CDC Foodborne Illness Outbreak Guides, which provide guidance for identifying, investigating, and responding to outbreaks. And then, when we're sharing these materials, DI professionals should make sure that, we're using the most current versions of what CDC resources that are available. Also, that they're meeting, 508 accessibility standards, so that way they're also as accessible as they can be to the widest range of audiences. Public health programs are, really encouraged to kind of build partner networks with a variety of support organizations within their communities. These partnerships help expand the reach of services and really help ensure that individuals can access the resources that they need. Support organizations may include groups such as like reproductive health organizations, schools or universities, correctional facilities, faith-based organizations. Other partners could really like it could include federally qualified health centers, substance abuse treatment facilities, mental health services, housing programs, community-based organizations, and like Ryan White clinics, for an example. Working together allows organizations to kind of pool their skills and knowledge and resources, which can lead to more coordinated and effective service delivery. In this network, DI professionals often serve as facilitators, really helping to share information between partners and strengthen communication across the system to support, better health outcomes for the community. Creating and maintaining partner networks with support organizations is an important strategy for improving public health practice or public health outcomes. When organizations work together, they can combine their skills, their expertise, and their resources, again, to better meet the needs of the communities that they're serving. This this collaboration helps healthcare providers and community partners deliver services in a way that is more coordinated and efficient and effective. And by sharing responsibilities and resources, partners can address health concerns more comprehensively as well. Within these networks, disease intervention professionals play a key role as facilitators. Again, helping maintain that flow of communication between partners, ensuring that everybody is staying equally informed and, coordinated and able to, again, respond to things effectively as the public health approaches require them to be. In special populations, are groups of people who may be disproportionately affected by certain diseases due to social, structural, or environmental factors. And these factors can include things like limited access to healthcare, language barriers, housing instability, or other social conditions that influence health outcomes. Because these groups may face increased risk, they are often prioritized for prevention, screening, and treatment initiatives. Examples of some special populations can include pregnant individuals or people experiencing homelessness or individuals who are immunocompromised, people involved in the justice system, or, certain populations that experience health disparities. you know, I think being able to recognize these differences really helps public health professionals ensure that services and resources are targeted to the populations who really need them the most. Disease intervention professionals play an important role in supporting and serving these special populations within their communities. One way that they do this is by educating individuals about current health threats and helping connect them with appropriate testing and treatment or other prevention services. They may also, educate healthcare providers and community partners about the needs of these populations, helping to ensure that services are more accessible and responsive. Another key role is building a partnership with organizations and facilities that are connected to these populations, such as schools or shelters or, again, correctional facilities. Through these partnerships, DI professionals can share information about disease outbreaks and prevention recommendations. That's all going to really help to protect the health of both the individual and the broader community. So special populations is that key word for this section that we'll want to be on the lookout for. And again, for a more full definition, you can refer to the CDI study guide. All right. Section 4, Partnership and Collaboration for Quality Care. So when disease intervention professionals and healthcare providers understand public health ethics and jurisdictional requirements, they're really better prepared to work together to deliver effective and responsible health services. This shared knowledge really helps to ensure that care is provided in a way that is ethical and compliant with regulations and responsive to community needs. Collaboration between DI professionals and healthcare providers and community partners allows for a wide range of important public health services. And these services can include, supporting treatment for infections or making referrals to other service providers, encouraging individuals to engage in care and providing education about prevention and health management. By working together and coordinating these resources, partners can help to ensure that individuals diagnosed with or that are exposed to an infectious disease really can receive comprehensive and supportive care while also at the same time strengthening public health efforts within their community. In collaborative settings, partners or healthcare providers may sometimes ask DI professionals to clarify roles and responsibilities. This is pretty common, and it's because the DI professional role can vary by organization and may be known by different job titles even. Generally, disease intervention professionals are public health professionals who specialize in preventing the spread of infectious diseases at the community level. We all know this, right? But while that, there are typically we're typically non-licensed professionals bringing specialized training and practical experience to public health response efforts. DI professionals help connect individuals diagnosed with or exposed to an infectious disease with testing and treatment and prevention services, and they carry out this work using, key skills such as case management, interviewing, field services, contact tracing, outbreak response, and case analysis. And by clearly being able to explain your role, DI professionals can then help partners better understand how they support public health efforts and how collaboration between the two can strengthen care for individuals and communities. One of the core responsibilities of disease intervention professionals is helping connect individuals diagnosed with or exposed to an infectious disease to appropriate testing and treatment. This work is often done in partnership with healthcare providers or clinics or laboratories to ensure that individuals are able to receive timely and appropriate care. Clinical guidance for treating many infectious diseases is provided through national guidelines, and these guidelines offer evidence-based recommendations for diagnosing and treating common infections. DI professionals may use these guidelines to verify that appropriate treatment has been provided, educating individuals and clinicians about recommended care, and then identify any additional referrals that may be needed. A variety of service providers work alongside disease intervention professionals to ensure individuals affected by infectious diseases receive appropriate care. These providers may include family planning clinics or public health clinics, HIV care clinics, emergency departments, and private physician offices. These partners play an important role in testing, treatment, and ongoing care for individuals diagnosed with infections, and their established presence within a community allows them to reach populations that may otherwise have more limited contact with public health services. And working with these service providers also helps DI professionals build trust with individuals receiving the services. So by being able to leverage the relationships and resources that these partners already have within the community, DI professionals can really improve access and care and strengthen the overall public health response. So when we talk about referrals, referrals are an important part of the work that disease intervention professionals do to help individuals access the care and services that they need. A referral occurs when a person is directed or connected to a specialist, a healthcare provider, or other organization for treatment or supportive services. To support this process, DI programs often establish networks and partnerships with a variety of service providers. These referral partners may include, medical care providers, family planning clinics, or harm reduction services, housing assistance, food pantries, mental health services, a myriad of different resources and referrals, right? And when we make these referrals, DI professionals may assess, what services a person may need, how open they are to receiving these services, and, whether there are going to be any additional barriers that could prevent them from accessing care. In some situations, DI professionals may also help facilitate like a warm handoff, meaning that they directly connect the person with the service provider, such as really helping to schedule an appointment or making an introduction to ensuring that the referral process is as smooth and supportive as it can be. Encouraging individuals who are exposed to or at risk for an infectious disease to engage in care is often done through a communication approach called motivational interviewing, or MI. Motivational interviewing really focuses on communicating in a way that encourages individuals to make healthy behavior choices while respecting their autonomy and personal circumstances. So, this approach relies on several key communication skills that could include active listening, which helps DI professionals really fully understand a person's concerns and their experiences, their current motivations, all while kind of using non-stigmatizing person-centered language is also going to really help to create a respectful and judgment-free conversation, which can then hopefully build that trust and openness. Another component that's really important is guided or shared decision making. And that's where a DI professional and the individual work together to discuss options such as treatment or testing or prevention strategies, and determine from there what steps may work best for that person. And by being able to utilize these techniques, DI professionals can really help empower individuals and build that self-confidence in their own decision making, and which is going to help better support their health outcomes in the long run. Disease intervention professionals often help ensure that both healthcare providers and individuals receiving services have access to accurate educational resources. Providing clear information about infectious diseases, treatment options, prevention strategies can really all help people better understand their own health and make more informed decisions about their care. Education also plays an important role in reducing the spread of infectious diseases. When providers and community members are more informed about testing and treatment and prevention, they're more and better equipped to respond to health concerns and support healthier outcomes. In some programs, DI professionals may also kind of help compile educational materials or provider packets that can be used during health provider visits. These materials may include, treatment guidelines or reporting requirements and other really helpful kind of resources that keep providers, again, informed and up to date on public health recommendations. And by sharing these resources and having them readily available, DI professionals can improve both organizational and personal health literacy while then strengthening the overall quality of care that's going on within the community. All right. So in the chat, let's take a quick pause. Go feel free to type in chat if you don't mind. To ensure individuals receive adequate care from health service providers, DI professionals may assist with compiling, again, educational resources for both providers and people diagnosed with or exposed to an infection, right? So in the chat, tell me what are some key resources that you may currently use or that you know of your organization or jurisdiction using as a referral source for the people that you are working with within your communities. Patriot Housing, Ryan White. Your state health department does handouts. Yeah. CSTE guidance. Love that. Lots of handouts, information packets, support groups. Oh, that's awesome. Yeah, it sounds like you all have a lot of great resources readily available already to be able to use and to contribute to the community. So that's awesome. 411, yep, that's another great one that I think people have been thankfully using and able to use for a long time. Awesome. Yeah, thank you. So yeah, we have all of this plethora of resources that are available. I think new resources come and go all the time, but making that connection within your own communities, really understanding what's available, what folks have access to, and then being able to share that helps not only that individual but the community at large itself. So yeah, thank you all very much. All right. So some key words from that last section that I want you all to remember is referrals, harm reduction, warm handoff, and motivational interviewing. And again, these key words can be found with their full definitions in the CDI study guide. All right. Our last section, I believe, collaborative case review for quality improvement. So, case management is a key part of the work performed by disease intervention professionals and is also recognized by NBPHE as one of the core competency domains for this field. Effective case management really helps to ensure that individuals diagnosed with or exposed to infectious disease can receive appropriate care and follow up and support. One way to really strengthen case management is through collaborative case review. And this process is going to look like or involve working with partners and support organizations to review cases and identify where areas where processes or services can be improved upon. Through these discussions, DI professionals and their partners can then kind of identify quality improvement opportunities, address challenges, and then refine strategies to lead to more effective case management and better public health outcomes. Case management involves the documentation and analysis of patient health information for the purpose of planning and executing disease intervention initiatives. Case management involves documenting and analyzing health information, right, to guide these disease intervention activities that are, and really to ultimately help ensure that individuals are receiving appropriate care and follow up. The case management process typically follows several key steps that help the DI or DI professional investigate and respond to the infectious disease cases. The process often begins with a pre-interview analysis where the DI professional reviews available information before contacting the individual. This is then followed by the original interview, where the information is collected about the person's diagnosis and contacts and potential exposures. And then after the interview, post-interview analysis helps identify next steps. That can include referring individuals named within the person's social or sexual networks for testing or services. DI professionals may then contact or conduct interviews with contacts who may benefit from testing or prevention services. And then in some situations, re-interviews may be necessary to gather additional information or to clarify details. And then finally, the process concludes with the case closure once the investigation and follow-up activities are complete. Together, these steps help DI professionals systematically manage cases and support efforts to prevent further spread of infectious diseases. Case review is a really important step, and that follows the case interview in case interview and investigation process. It involves reviewing the information collected during the case to better help understand, how the case was handled and what outcomes were achieved. This process typically is a collaborative effort involving the DI professional, their supervisor, and members of the clinical care team that were working with the individual. And so by reviewing the case together, these partners can really ensure that the investigation was thorough and that the individual received appropriate care and services. Collaborative case review also helps really to strengthen communication between public health professionals and healthcare providers. Case review also provides an opportunity to identify areas for quality improvement within the case management process. So by evaluating how the case was handled, teams can identify ways to improve future investigations and future public health responses. Oh, sorry, folks. I can't remember. I think we're on this slide. Maybe that's one. Apologies. Okay. So we are going to talk about treatment recommendations and collaboration. So treatment recommendations are an important part of the case management and can also be reviewed during the case review process. So DI professionals may work with laboratory partners and healthcare providers to verify that the recommended treatment aligns with current clinical guidelines. If treatment was not provided or needs to be adjusted, the DI professional can really help connect individuals to the correct treatment services. And this collaborative review really helps to maintain accuracy, quality of care, and effective disease control efforts. Reviewing key case elements during a collaborative case review can help the DI professional really strengthen case management strategies. So, looking closely at information collected during an investigation may reveal important details or identify partnership opportunities that were kind of missed. Key case elements may include demographic information such as age, group, gender, sexual history, or occupation. It can also include location-related information, such as, whether an individual is connected to a school or a workplace or a correctional facility. And then reviewing these details can then help teams better understand patterns of disease transmission and then identify the opportunities for improved collaboration and response. Another important part of case review is identifying missed opportunities, right? So these are situations where an additional action could have improved the investigation or better supported the individual receiving services. So, for example, missed opportunities might include gathering more detailed information during interviews or identifying additional contacts or, connecting individuals to services that were not previously offered. And like them recognizing these opportunities helps the DI professionals to refine their approach and improve outcomes in future cases. Routine evaluation is an important part of quality improvement in public health programs, right? So case management activities should be regularly reviewed to ensure that processes remain effective and that they're responsive to community needs. Collaborative case reviews allow, again, DI professionals and partners to really analyze these cases together, identify strengths and challenges, and develop strategies for improving services and interventions. And so the following slides really highlight additional areas that can be considered when reviewing cases for quality improvement. So although collaboration strengthens case review, working across multiple organizations can also create communication challenges, right? So establishing clear communication strategies can help prevent misunderstandings and ensure that partners really remain aligned. Effective strategies may include defining roles and responsibilities, identifying communication channels for sharing updates, and setting expectations for how often partners will need to communicate. It's also important to document expectations and policies and procedures, and all of the partners understand how that information should be shared and how collaboration should occur. And so by creating clear communication structures, teams can then work together more effectively and support better case management outcomes. So when we think about best practices, and I think it's trying to establish best practices among collaborating partners, we can really help to ensure that the case review process is both efficient and effective, right? So, partners may begin by agreeing on a shared purpose or vision for the review process and identifying a strategy that clearly defines the roles and responsibilities of each participant. It's also important that the review process reflects cultural humility and health equity, really ensuring that different perspectives from individuals receiving services and providers are considered. And then finally, partners should maintain clear communication and identify action items or next steps following the review to support continuous improvement. So, in conclusion, collaboration between disease intervention professionals and community partners is absolutely essential for providing accessible, equitable, and effective care to individuals and communities affected by infectious diseases. Successful collaboration depends on several key elements. DI professionals must follow public health principles and ethical standards, serve as a local resource for public health information, and really build strong partnerships with healthcare providers and other community organizations. Throughout this domain, we discussed important considerations that support collaboration, including ethical practice, communication strategies, provider education, partnerships with support organizations, and collaborative case reviews. And together, all of these concepts provide for a framework for DI professionals to strengthen partnerships, share knowledge with partners, and support the delivery of high quality services to people who are diagnosed with or exposed to infectious diseases. And ultimately, applying these principles helps to improve health outcomes in the communities that we serve. And then our big keyword for that last section is case management. Again, you can find that full definition in your review, our CDI study guide. And now we get to start applying what we learned through our exam prep questions.
Yep. Thank you so much, Brandon, for that. That's a pretty dense domain. So really appreciate you going through it with us. All right, here we're going to go. You can go to the next slide, and at the same time, I will launch the quiz or the practice question one. So you can see here the question. Choose the best answer for this question. And again, we'll give it, a minute or so to allow everyone to input their thoughts. All right, I am going to end the poll now, and I can share the results with you all.
Absolutely. Correct answer was number two, state and local health departments. And we can see our rationale behind that, health or state and local health departments set and enforce communicable disease reporting requirements, and then they are the authoritative resource for reporting questions. Nice job, everyone.
Yeah, great job, everyone. Okay. All right, we'll go to question two, and I will go ahead and launch it.
Okay. Which of the following communications of health information would HIPAA prevent?
Let me know if you can see that. Your internet connection is unstable. Okay, did it show up now?
It isn't up now, yes.
Okay, great. Sorry about that. I don't know why my internet connection is unstable. It never happens, but of course, when we're on a presentation, it would. So yeah, if you guys can choose what you think would be the best answer for this question, and when I get a significant number of responses, I'm not going to hold everyone to that 100, but I'll give it maybe 10 more seconds. So if you haven't answered and you have an idea, just put your best guess in there. All right. Okay, I am going to end the poll now. And I will share the results. Can you see that, Brandon? Oh, it's still,
Not quite yet.
you know, let me go and close some of my windows.
Do you want me to move on with revealing the answer?
Uh, let's see. All right, I'm gonna just see if, well, I can tell you how people answered since for some reason my sharing isn't working. 93% answered selection one.
Awesome. It looks like you may be frozen if you can still hear me at all, unless I'm the one that's frozen, and that would just be embarrassing on my end because I'm essentially going to be talking to myself at this point. But if you all can still hear me in the chat, if you could let me know, I think.
Hi,
Okay,
Brendan.
perfect.
We can
Thank you.
definitely hear you, but I think Melinda froze. So if you'll just walk through them verbally until Melinda can
Yeah.
get back on. It looks like she crashed, and I don't have the polls on my side.
Awesome. Yep. No, thank you. I appreciate
Thank
you
you.
all letting me know. So yeah, that selection that we were looking for, that best answer is selection one, and we can see the rationale behind that is HIPAA really protects patient confidentiality. Sharing diagnoses with emergency contacts requires patient authorization unless the person is incapacitated. So the other scenarios involve public health or continuity of care, which HIPAA permits. All right. Question three. If you want, you can put your answer in the chat and I'll kind of start to see those filter through since we do not have our access to our polls. But what agencies primarily communicate public health recommendations to a community? Is that provider offices, health departments, or social media? I'm seeing a whole bunch of twos. Yeah, absolutely. Y'all are on it today. And that is two health departments, local, state, and federal. Health departments have the responsibility for issuing public health guidance to communities. Providers and social media may share information, but health departments are the authoritative source. Okay, no worries at all. I'm happy to walk through them verbally this way.
Yeah,
But
I
yes,
just,
great job.
sorry, Brandon. The polls aren't working for me, so apologies to the audience. Or they were sort of working and then caused my system to crash. So I'm going to let Brandon go through them. Thank you all.
No worries. All right, question four. Which of the following activities involves working with schools or correctional facilities? What do we think our best answer here is? I'm seeing a vote for option one. Yeah, now a bunch of ones are rolling in. Yeah, absolutely. So DI professionals are going to need to collaborate with institutions like schools and correctional facilities, especially during times of outbreaks, and apply mitigation strategies to protect those populations, of course. So the other options are not appropriate or necessarily realistic for DI tasks. So yeah, following the CDC guidelines for mitigation strategies of a possible disease outbreak in public facilities. Great job, everyone. All right, halfway through. Which types of resources would DI professionals be most likely to provide to a medical provider? Fact sheets and posters, interpretation services via phone or tablet, or masks and gloves? Yeah, you are all on it. I'm seeing a whole bunch of ones in the chat. And you are correct. Yeah, fact sheets and posters about communicable diseases. So we're gonna support providers with educational resources, technical assistance, and up-to-date information. PPE or personal protective equipment and interpretation services may be important, but are not typically supplied by DI staff. Absolutely. All right. Number six. What additional infectious disease information must be reported with all presumptive and confirmed cases? So, best answer for additional information that must be reported with all presumptive and confirmed cases. Wouldn't three be a good answer as well? Yes, and I think, on the exam, it may look like there are multiple answers sometimes that could fit. If I'm speaking out of turn, folks from NB PhD, please let me know, but it's about finding the one that fits best. So which one do we think fits best? Seeing a bunch of threes. I think I saw maybe a few ones, but looks like majority of y'all are saying three. And let's see. Yeah, absolutely. So we're gonna number three is identified symptoms, treatment, and contact information. Absolutely. So our surveillance is going to require more than just case identification. So that's when the stage and clinical history and treatment status really help to determine disease burden, transmission risk, and resources that are going to be needed. Good job, everyone. Question seven. After notifying a person who has been exposed to an infectious disease, what should a DI professional do to ensure the person gets examined and treated? Two, one, two, one. Okay, I think we have a little bit of a battle back and forth for the two and the one on this one. Yeah, and remember, we're going to go for that best answer. Oh, I saw three come in. Okay. Oh, okay, this one's going to be a tricky one. All right. So, what should a DI professional do next to ensure the person gets examined and treated? And that answer we were looking for number one, assess the person's access to a medical provider, right? So a core responsibility of a DI professional is connecting people diagnosed with or exposed to an infectious disease to appropriate testing and treatment in partnership with healthcare settings and laboratories. If so, we really need to look at that person's access to be able to assess their access to medical provider and what may be available to them in their own community, in their neighborhood, etc. Perfect. Number 8. How should a DI professional proceed if they receive a positive lab report without any notification from the ordering provider's office? Seeing some ones come in early. Okay. Looking like a bunch of ones. Yeah, I think you all are leaning towards one on this one. I'll wait. All right. And you are correct. Yeah, absolutely. They're going to want to reach out to the provider's office to discuss test results and reporting requirements, right? So timely follow-up with the provider helps to ensure more complete case and surveillance information, prompt notification, and appropriate treatment. Nice work, everyone. All right. Question 9. Why is it essential to identify barriers while interviewing a person exposed to or diagnosed with an infectious disease? It is essential to identify barriers. Seeing a bunch of ones. I did see a 3. What else are we thinking? Seeing ones. Another 3. Okay. Looks like the majority of you are decided on 1. So let's go to our next slide and see. Absolutely. Yes. So that best answer that we were looking for was number 1, to address issues that might interfere with the completion of treatment. So our rationale behind this is really addressing barriers as essential because delays or gaps in care can then allow the disease to spread or worsen both individual and public health outcomes, right? So we want to address that as soon as we can to ensure that we are no longer um, the risk of transmission is much lower. All right, I believe this is our last question, folks. So question 10, how would a DI professional explain their role to a member of the public? Which one of these do you think gives the best explanation for the role that we should be given to the public? Seeing 2, lots and lots of 2s. You know what? Y'all are smarty pants today, because that is also correct. Yeah, we're going to focus. Your answer to something like this could be I focus on investigating and preventing the spread of infectious diseases. You know, that key responsibility of the DI professional is to investigate reported cases of infectious diseases and notify potentially exposed individuals so they may, again, obtain their appropriate evaluation and treatment as needed. Awesome work, y'all. So I know that we have some time left over at this point, and I want to open it up to a Q&A. Happy to answer if we see things pop up through chat. And I know, I think, I don't know if you all are able to come off mute or not, but I know Melissa and Melinda are also happy to answer any questions that you all may have about the CDI exam itself or preparation or anything along those lines. So we are here to answer all your questions.
Yes, and I'm here, and if I stay here, I can take people off of mute. So happy to answer any questions you all have, and our sincere thanks, of course, to Brandon for his work on this. There's a
Absolutely. I'm
question in
happy
the
to be
chat.
here.
I had uploaded the link to the recordings earlier, but I will put it back in the chat. All of the review sessions are being recorded and they're available through our YouTube channel. And I just put the link in the chat. Oh, and Elmaris is taking the exam tomorrow. Good luck. Yay.
Yes, good luck.
Um, Curious if anybody played with the interactive knowledge check since last week that was just sort of launched. We're excited about that one. Would love to hear your feedback on that. Um,
Well, good luck to everyone taking the exam
oh
tomorrow.
yeah, look at all you go-getters right on July 1.
Yes.
Hey, that'll be a great start to the month. I'm excited for all of you.
Nice.
Great.
Great.
Hey.
Carlos has a question and wants to contact me directly. Carlos, I will send you my phone number. Oh, except I sent it. Oh, yeah, no, I did. Good. Okay. Hopefully you got my phone number. If not, for anyone that has questions, you can always reach out to us at info@nbphe.org. We do check it multiple times a day. I'm on there all the time. So Lenore is asking a good question. Do we need to know treatment guidelines? So um, the CDI exam really is intended to kind of go beyond specific disease knowledge. So we assume that your programs are training you on the diseases that you investigate, as far as like, specific, like what are the 4 drugs that treat tuberculosis? There won't be treatment specific questions on the exam. Some questions do mention a disease, but it doesn't necessarily pertain to the answer per se. Like it might be a scenario question where there is a disease mentioned, but we worked pretty hard to pull out disease specific questions because we didn't want all of our STD people to have to learn everything about foodborne and all of our foodborne people to have to learn everything about TB. So we just kind of decided to make it disease agnostic.
And there was
Um,
someone has their hand raised, and I tried to unmute. You should be able to talk now. I think Abby, if you unmute yourself on your computer, you should be able to ask your question. If not, um, if you could put it in the chat, that would work. Let's see. I will try to unmute some other people.
oh, it was a mistake. It said, I did
Okay.
see so Enrique is asking about the number of choices. There are 3 choices. So it's the one correct answer out of 3 choices, and there's no like all of the above. It's a single best answer out of 3 choices for the exam. And then I see there was a request for
Marlene.
Marlene. Yeah, Marlene, it sounds like you're having trouble rescheduling a retake.
Yes, I was unable to take hi Melinda. First of all, hi Melinda, hi Melissa. I was unable to take my test back when it first was available, and I'm
Okay.
trying to reschedule, and I've used my password, but it will not accept my password. I reset the password, and it won't allow me to reset in order to reschedule.
Hmm.
Is that your password through Measure Learning?
Yes,
Okay, so did you receive a scheduling email from Measure and then you're
I
just having
did.
trouble logging in? Okay, so for that, we don't have anything to do with scheduling. Once you're approved from our side, it goes to Measure Learning and they do all of the scheduling and proctoring and all that kind of stuff. So the best way to reach out to Measure is candidate support at measurelearning.com.
Okay.
That's a way that you can reach them via email. They do also have a phone number that, because I'm 52 now, I don't remember. I don't have it memorized. So let me pull the phone number up.
Is
Uh,
it is the 202 number?
no, that's us, and we'll just send you back to Measure. It's a 919. It should be in all of their correspondence, but
Yes, I
I do
have it.
have it.
I
Okay.
have that number.
That 919 number, if you're just having trouble logging into the scheduling portal, they should be able to help you with that. We can't access that at all. So, um,
Okay.
yeah. And then, yeah, I do see somebody's asking Annalie Gooms, I will call you. And what else? I think are we caught up? Um,
Looks like it. I do have one additional poll. that I will ask you guys to answer, but Melissa, did you want to say anything else?
I did want to say, so for folks who are trying to schedule your retake, you don't have to reapply to retake the exam. So if you took it once and it didn't quite go your way and you're studying just to get that last little bit and you're going to take it again, you can log into the certification portal, the same place where you submitted your application, and there's a button that just says register. So you don't do a new application, you just re-register for the exam because we know that you're already eligible. That said, we do have a technical glitch. So we sort of broke the matrix with the closing down the spring window and opening the summer window. There have been some technical glitches in our system because of that process. So we're hearing from folks who did re-register for a retake, but they haven't gotten any scheduling instructions, and it's been like over a week. So we think there's something funky happening between our certification system and Measure Learning, that communication. I don't know anything about computers, but somehow they're supposed to communicate and they're not. They need to go to couples therapy or something. So we're working on the technical fix for that. But if you're not receiving your instructions to schedule for a retake and it's been more than like 72 hours, please reach out to us. And I'm putting our info. Oh, and then we do have somebody, is there a waiting period to retake if you fail? Cassandra's asking, so if you can do your initial attempt and your retake both during the testing window, and there's really no artificial hold on our side. It's just that once you're approved for the retake, you have to wait at least 72 hours to be able to schedule. And that's on the proctoring side. There's just a little bit of a hold so that our testing centers aren't scrambling with very little notice to get somebody booked in for the exam. So, but otherwise there's no like hold period. Once you've taken it twice, you do have to wait a full year, and that's so that we don't have people taking the same version of the exam. It kind of risks overexposing the exam. So we have our two chances this go around, and then you'll have to wait for a new exam form to be released next year. And then we did have somebody who was asking, can you go over the cluster associate for interview? That's probably more of a domain 2 question, but I'm happy to entertain and kind of talk through a cluster interview. The cluster interview is used to identify essentially people who are not direct contacts, but who may be at risk, either through shared space, similar risk factors, or symptoms. And you can do a cluster interview of someone who is negative or who is positive. But the goal, so let's say, I'll give an example. If I'm interviewing somebody who injects drugs and they're co-infected with HIV and hepatitis C, and they give me their contacts, they tell me who they've had sex with, who they've shared needles with, and then I ask them, who else do you know that would benefit from testing besides these folks? People that you see around, people that you hang out with, people that you know are sharing needles or maybe putting themselves out there sexually and not likely using protection, because we think this infection is in your network. And even if you did not directly share needles with them or have sex with them, we're happy to reach out to folks that need to be tested. And that method is called clustering. So we're identifying, it's like a target, right? We have the person with the infection in the center of the target. The next rung out is our contacts. And that next rung out are our like associates and social contacts, who are people with similar risk factors or similar geography. Like for COVID, somebody might say, well, I was at a wedding and I didn't hang out with everyone at the wedding, but probably everybody at the wedding might have been exposed. I don't know. And those other people at the wedding that they didn't stand within 6 feet of would still be considered exposed or potentially exposed or at risk. So that's kind of the idea around clustering, is just zooming your lens out a little bit beyond those direct contacts and looking for other people who may be at risk. Yeah. Okay.
All right, I'm gonna just first I want to just thank Brandon again sorry, I'm going on and off camera, Brandon from NCSD for coming in and doing this very dense domain. We really appreciate him. And I will close it out with we have a quick couple questions we'd love for you to answer if you would. And hopefully we'll see you all next week for our final review session. So hopefully my system will launch the poll and will not crash. And if you don't see it, I don't know if Melissa is able to go in and do it.
The last little eval, I don't have access to the polls because I'm not the host.
Yeah, okay.
If you try making me the host, maybe I'll see them. I
All
don't
right,
know.
because I'm trying and it says,
And yeah, we're in the home stretch, folks. We've got one more review session. It's our emergency preparedness and outbreak section. And then we will have done all 6. And some of you have been with us the whole time. And some of you have joined us as you've become eligible or approved for CDI. And we're like becoming a little family. I'll miss you all when this is all said and done. But yeah, let me see if I can. Did you make me host, Melinda?
I am trying make host. Okay, change host. See if you can do it.
Okay.
You're a host now.
Says I am. Polls and quizzes. Huzzah. Okay, hold on.
You got to go all the way
all
to
the way down. Is it a general one, Melinda?
Yeah, there's one that says copy of
Participant reflections.
Yeah.
Okay. Did anything happen?
I'm not seeing anything.
Second to pop up there towards the end before before the chaos happened with them again, but I'm still not seeing anything yet either.
Oh.
Yeah, I don't know if it's Zoom or what.
I don't know either because I hit the
Between me
launch
and you
button.
losing internet and the poll's not working, it's just been
Right. I think there are
a
gremlins that
stressful
come
last
to
20 minutes,
this
but at least it
thing.
happened at the end.
Yes, exactly. Well, thank you all. Sorry we couldn't get the polls to work. If you have any thoughts you would like to share, please feel free to reach out to us. And yeah, with that, we can probably end, Melissa.
Okay.
Thank you
Thanks,
all.
everyone. Good luck to everyone who's testing tomorrow. You've got this.
Yes, let us know how it goes. Bye.
Bye.
Bye.